Continuing with Chapter 2 under Legal, there are laws concerning confidentiality. Employees must abide by the federal regulations, 42 CFR and HIPAA, governing client confidentiality, being aware that a violation of confidentiality can result in a fine, criminal prosecution, loss of licensure, certificate, and/or disciplinary action. Name some things you need to do to protect confidentiality. Client files and case materials should be handled, discussed, and stored in ways that maintain confidentiality, including the locking of file cabinets that house client information and shredding of all documents. You must have 2 locks in order for file cabinets to be secure. Do not discuss cases only when there's a need to know. Shred all documents. Don't discuss client matters in a hallway. Protect your notes and documentation. Computer screens need to not be in view of clients. Put away all materials at night and when the clients come into your office for sessions. What about emails? Use the minimum necessary rule. Only release minimum information needed for the other agency to fulfill their responsibility to the client. 42 CFR federal regulations are very specific and restrictive. All client or drug abusing information is to be held in strict confidence. With regards to emails, that means no client identifying information in the subject line or in the body of the emails. Emails need to be encrypted when you communicate with others. Ask your supervisor about the confidentiality regulations of that agency. The 4 big exceptions to confidentiality is harm to self, as in suicide, harm to others, such as homicidal threats or domestic violence or terrorist off, child abuse reporting, and elder abuse and dependent adult abuse reporting. When you are working in a team, all team members need to agree on what is the need to know, such as drug use, criminal activity, and general progress. If you are on a different page than your team members, then you are putting the team and the program at risk if you don't share information appropriately. The best practice is to have the client report on themselves to court, probation, child welfare services, or their employer. Again, for you to report, you do need a written release of information. In early treatment, the most important thing is for the client to learn honesty. It is more important to learn to tell the truth than even to stay clean in the beginning. Always inform a program supervisor as soon as possible anytime you go outside to report an incident. HIPAA was passed as a federal law regarding confidentiality for health communications in 1996. HIPAA security regulations are about equipment and hardware, such as passwords, placement of copiers and printers, and access to database information. HIPAA stipulates what must be on a release of information form. It includes identifiable health information and patient health information. Clients have the right to ask that this information be restricted. Clients also have the right to access their files, make copies of their records, make corrections or additions to their files, if these are accurate, to be included. The original purpose of HIPAA was to provide patient access to their own records, helping clients to understand their own medical care and to take better control or at least participate in their medical care. The secondary original purpose of HIPAA was in the era of electronic health records and more computerization being developed. It was important to spell out what were security and communication protocols for billing information for the doctors, offices, clinics, and hospitals. Speaking of developing electronic computer systems, platforms, and apps such as Facebook, social media and networking is a way to connect with those who experience our work. However, away from the work site, it helps to be able to talk frankly about what happened. But social media and networking sites are not secure. Comments can be read by others and misconstrued. It is unethical to talk about clients in any forum where confidentiality is not guaranteed. That includes Facebook and Skype. Privileged communication is a legal concept. It is protecting the right of the client to withhold information in a court proceeding. This includes subpoenas and court orders. This is a complicated area of ethics and is best to see your supervisor right away in these cases. We have an ethical responsibility to the client. Don't burden the client with your problems or tell clients that worse has happened to you. Don't ask a client to meet your needs. For example, asking them to buy Avon from you or buy insurance from a friend who's starting an insurance business. Also, don't insist that clients do what you think the client should do. Don't insist that your solutions are the only right solutions. Don't continue to treat the client as being in need of your services when the client has grown beyond these needs. There are 4 reasons clients are often mistreated. Either the worker is maybe unpleasant to everyone. Well, this worker needs to take some more courses, develop some more interpersonal skills, and get some good feedback. This is the worker's issue, and the worker needs to change. Consider how you would react if you got feedback that you were being gruff or inconsiderate of clients. Number 2, the worker needs to feel superior and to have power over the client. The feelings of superiority and control are problematic. It is common and true that as a counselor case manager, you do have control or power over your client. However, using the power or control to gain personal benefits or to put others down is abusive. Number 3 and number 4. The worker has no supervisory support and feels isolated, and so they develop us versus the client's attitude. Or the worker is trying to control unpredictable behavior, perhaps with verbal or physical aggression, because the worker lacks training and support to handle the behavior. When the worker realizes they are in over their head or unsupported by their supervisor, they may indeed feel isolated and develop an us versus them attitude. In this case, the worker needs to request more supervision or consultation. If the agency is unable to provide this, you need to seek it through Questa College, say during your internships, or you may need to join a supervision group. Ask. Don't let this reason derail your career. This is one of the most common complaints that rises to my level about counselors or case managers. They never return my phone call. Or, my counselor was rude to me because they told everyone in group that I was always relapsing. My case manager said I would be kicked out of the program if I didn't get a job and start making payments. But I don't even know how to get an ID, much less a job. Be prepared by knowing your own values and feelings about certain value-laden issues. On page 42 in your textbook, there is a self-assessment exercise on values conflicts. If you have blind spots about your own values, you may inadvertently pass these along to the client. For example, let's say you have a high value on education. Therefore, you steer every client who gets into recovery to go back to school. Is this a problem? Why? We will cover informed consent more in Chapter 15 in Week 9. However, at this point, informed consent consists of 3 parts. Capacity. Does the client have the ability or capacity to make clear, competent decisions on his or her own behalf? Number 2, comprehension of information. The client clearly understands what is being told to him or her. To make sure this is so, give the client information carefully and check to see if the client understands what you have told him or her. This is especially important in drug treatment programs where the client may be coming in under the influence. Do they have the comprehension of the information that you are giving them? And number 3 is voluntariness. The client gives his or her consent freely, with no coercion or pressure from the agency or professional offering the service. Now, on to Chapter 3. We use the ecological model to describe the various levels of intervention that a case manager can make. The environment and other people outside of your client impacts the client's health and well-being. Remember, case manager's job is not just the person or the client, but the whole context of the person's life. It is a combination of factors that have brought the person to voluntarily seek help or to be mandated into treatment. There's a story for saying, for example, pull yourself up by your bootstraps. Well, sometimes you need more than the motivation to reach for your boots. You may need help finding a decent pair of shoes, learning how to put them on, learning how to walk in those shoes, having someplace meaningful to walk to. You may find that some people are hoarding all the shoes, making it difficult for you to find them. Maybe the only shoes available to you are the cheap ones that fall apart. Maybe you find that the shoe stores are closed to you, perhaps because of your schooling, your race, or your gender. So remember to put everything into perspective, to have a balanced view of the client. There are 3 levels. The red inner circle is the client and the micro level. The micro level is divided into 2 different areas: personality characteristics and biological determinants. Meso and macro are both context or environmental levels. The meso is the personal context, so that's indicated by the white circle around the client with the diagram on the slide. The macro level is the social context, indicated by the blue circle around the client and around the client's environment. This is the micro level, divided into those 2 components. All of these micro level attributes is what the client brings to you, the case manager or the counselor, and affects the problems that they are bringing to you to solve. No 2 clients are exactly alike, so your interventions will be different depending on what the client brings to you. The client also has normal life changes, but some people have a difficult time adjusting to these normal life changes than others. And when developmental transitions pile up, this can be harder to handle. I have 2 close friends that died earlier in the year. My first grandchild was born 3 months ago, and I just got a promotion. Even though some of these developmental transitions are positive, when they pile up in a short period of time, they can easily overwhelm a normal person. Remember, the client's presenting problem may be a reaction to a normal life transitional phase, rather than an ongoing problem or diagnosis. It is a short-term issue to resolve. Using a 2-pronged approach, the best thing is to always provide an intervention to the individual at the macro level and one other intervention at the environmental level, either at the meso or at the macro. A case manager is usually a generalist, meaning they handle different client problems at all levels simultaneously. Multi-level assessment is when the case manager can assess all 3 levels for each client issue. The generalist approach has its goal to better functioning and increased competence of all parties, including the meso and macro levels. such as the education system or the criminal justice system. This creates solid and long-lasting change, far beyond just the one client. Macro-level interventions you may recognize as advocacy. Macro-level questions. Name some things that you think should be changed or introduced to the San Luis Obispo community regarding social services. What's missing? What are the barriers? What is the large macro level picture? The reason for the client's problems may lie in the context rather than the individual or micro level. So your interventions and your referrals need to match the context of this ecological model. Now, it is your turn to practice developing multi-level interventions. See pages 91 to 93 in your textbook to design interventions at all three levels for your client. Your resource directory assignment is coming up. It is your first assignment worth 25 points and is due February 16th, 2020. It's time to begin working on this assignment. Your task is to create the beginning of a resource directory for yourself to use as a case manager. First off, you will choose one topic area, say homelessness, and you will research 3 different community resources to help with homelessness, meaning shelter services in this case. This is not just information that you can get from a website. I want you to develop really some specifics and put them in your resource directory assignment. For example, call up the Prado Homeless Services Center, or better yet, go there. What is it like? Who is the specific person to talk to? What is their phone number? What does it take to stay a night there? What are the requirements? More points for more details. See the grading rubric. You will need to write up a minimum of 3 pages, including some general statistics on your topic area. Write about a minimum of 3 community resources. Submit your paper online through the assignment module. Consider having your client matched up with the topic area that you will research. It's not a requirement, but it may help you later, say when you do your progress notes.